Hello everyone. Today I will be talking to you all about a fairly uncommon topic that many of us might not have a very clear idea about. You might have seen on the news or read in the newspaper about certain celebrities who store up their baby's umbilical cord at birth for future use. So we might all have a question in our mind. What is this umbilical cord blood? Why do we need to store it? Where do we store it and how do we store it? I did not store my child's umbilical cord when she or he was born. What do I do now? Have I lost out on something? I'm pregnant. Should I be storing my baby's umbilical cord when he or she is born? What if he needs it in the future? Let me try and answer some of these questions for you in this short video as we celebrate July as the Cord Blood Awareness Month. First of all, what is umbilical cord blood? It is the blood that is collected from your baby's umbilical cord just after birth. It is very special because it has hematopoietic stem cells which have an amazing ability to transform into different kinds of cells. This is why it can be used in the treatment of genetic disorders, leukemias, lymphomas and certain cancers. Only 25% of children can find a HLA matched sibling, which makes HLA matched transplants very challenging. Unlike a bone marrow transplant, umbilical cord blood transplant does not have very stringent criteria for HLA matching, which makes it a good alternate source of stem cells for transplant. Also, it is quite easy to collect. There is no risk involved to the mother and the baby, and there is no extra cost for collection as well. So what does this mean? Should we all be storing up our children's umbilical cord blood when they are born? Can we use it as some sort of a biological insurance for God knows what disease might affect our family in the future, especially in this era of uncertainties and new diseases? The answer is a clear no. Indian Council of Medical Research has laid down very strict guidelines about the uses, indications and process of collection of cord blood. Presently, there is only one indication, that is if there is already an existing family member who is suffering from one of the diseases which have been approved to be treated by allogenic stem cell transplant. The list of these approved diseases can be found in the National Guidelines for Hematopoietic Stem Cell Transplant 2021. Any other indication for collection and storage of umbilical cord blood is purely experimental and not recommended. So where do we store this cord blood? India has 22 licensed privatized cord blood banks wherein umbilical cord blood can be collected and stored. We do not have a public cord blood bank in India presently. There are also certain disadvantages of cord blood banking. Because of the limited cell dose in the inoculum, it can only be used in children. Also, it cannot be used on the same person because the cord blood will have the same genetic composition as the person itself. Today, with the advent of HLA haploidentical stem cell transplant, every person has a good chance of getting a stem cell donor within the family. As a result, the use of umbilical cord blood for this purpose has come down worldwide and in India as well. So in case you're wondering whether to store your child's umbilical cord blood, you need to be aware of the correct uses, indications and need for storing your child's umbilical cord blood. Let us not use this as a biological insurance and let us not be carried away by claims made as such. Be aware, be vigilant and be safe. Have a good day.